In today's video, I'm gonna be talking about the new treatment that is just emerging, that is using the psychedelic medication to help people who suffer from depression and anxiety, but also post-traumatic stress disorder. So first of all, what psychedelics are? Psychedelics, they actually occur in the form of edible fungi. And the psychedelic word comes from Greek and it means mind manifesting, showing the inner world of our human mind. And I'm sure you must have heard of LSD, which is one of the most popular psychedelics. But we also have magic mushrooms, Psilocybin, peyote, Ibogaine, and MDMA. So all these psychedelics, they've been actually around for thousands of years. And we've been using them in different contexts, in context of religion, healing, recreation, magic, and also in context of personal development. However, these substances, they have been rediscovered only in the 19th and then also 20th century. And initially they have been classified as a hallucinogens, which obviously brings this negative connotation of people consuming the medication and then also having hallucinations, which is not the case when people actually consume them in a controlled environment, in an environment of therapy where the dosage is also being controlled. And only later this medication has been classified as psychedelics. The first research on psychedelics was conducted in 50s, but at the time FDA declared that there's no benefits, there's no medical benefits of actually consuming them. Luckily, the research continues, and the latest wave of this research on psychedelics actually proves us that there can be a lot of benefits of actually consuming this medication in a controlled settings, in a settings of a therapy, especially for people who suffer from post-traumatic stress disorder, depression, anxiety. And there's also research indicating that potentially people who even suffered stroke, they might actually recover much faster if they will go through the treatment when consuming the psychedelic medication. So like I said, there's actually a mounting evidence from the research indicating that when psychedelics are consumed in a clinical settings, there can be actually a huge benefit for the person. And because in today's video I want to focus specifically on post-traumatic stress disorder, I'm gonna actually take you through some very recent research that has been conducted towards the end of 2023 that was conducted on war veterans who suffer from post-traumatic stress disorder. Actually, majority of the research using psychedelic medication in context of the post-traumatic stress disorder has been conducted on war veterans. And one of the reasons for that it might be that because of the severity of the symptoms of the post-traumatic stress disorder, they're actually quite resistant to the standard therapeutic treatments. So the research I'm going to be talking about has been conducted at Stanford University in USA, and they used the specific psychedelic Ibogaine. And the results of the study, they indicate that Ibogaine was effective in treating symptoms of post-traumatic stress disorder as no other drug ever was. So before we're gonna go into detail regarding this research, I'm gonna give you a very brief overview of how psychedelics they work. So at the moment, we have actually quite limited understanding of how psychedelics they work. But what we know is that psychedelics, they actually stimulate very specific serotonin receptors. And these receptors are actually very important in higher cortical brain functioning. So what psychedelics they do, they actually produce unusual visuals. And these are not hallucinations. So these are additions or distortions to reality. On the other hand, what we would call hallucination is imaginative distortion that has no basis in reality. And in addition to that, we also know that psychedelics that actually produce sense of empathy, love, care, and that connectiveness with other people and also the surroundings. So now going back to the research that has been conducted at Stanford, they've employed 30 participants, 30 war veterans, and initially all of them, they were assessed using 6 functional dimensions such as cognitions, mobility, self-care, getting along, live activities, and community participation. Out of the 30 participants, 23 met the criteria for post-traumatic stress disorder. 14, they met criteria for anxiety disorder. 15 participants, they actually met criteria for alcohol addiction. 19 participants, they reported being suicidal, and 7 participants, they reported that at least once they tried to commit suicide. On average, the psychedelic treatment led to significant improvement in functioning, in decreasing the symptoms of post-traumatic stress disorder, and the positive effects of the psychedelic treatment was reported even 1 month after the treatment was finished, and that was when actually the whole research finished. So we don't know whether those positive effects they actually continue even longer. It is actually quite amazing that after the psychedelic treatment, participants that reported that on average their post-traumatic stress disorder symptoms they decreased by 88%, their depression symptoms they decreased by 87%, and their anxiety disorder symptoms they decreased by 81%. And again, on average, they reported a significant improvement in their memory, concentration, and information processing. So although we have all this amazing research with very promising data, psychedelics in the UK are still classified as illegal drugs, as the Class A drugs. So what this classification means that any drugs under the Class A are being recognized as not having any medical benefits for people and also being highly addictive, which already we know is not true, because now we have research telling us that there is a medical benefit of consuming psychedelics within the clinical settings. And also we know that psychedelics are actually being used in treating addiction, for example, alcohol addiction. In the UK, the penalty for actually having magic mushrooms, it is a prison sentence, and in some cases the sentence can go even up to 7 years in prison. Because of these very tight regulations around psychedelics here in the UK, it is actually very difficult and very expensive to conduct research on them. Fortunately, for example, Australia and few states in USA, they've already legalized using psychedelics in clinical settings, which is amazing because now they can actually provide treatments to people who suffer, for example, from post-traumatic stress disorder, who are quite resilient to standard therapeutic treatments. So we can only hope that with time, these drugs, they're gonna be also legalized here in the UK, so we can use them to help people to treat, for example, their post-traumatic stress disorder. So yes, that will be it for today, and if you found this video any interesting, then please like it, subscribe, and make sure you're gonna hit that notification bell, so every time when I upload new video, new short, you're gonna be notified, so you're not gonna miss out on any of this really interesting content. And I'm gonna see you in the next one then. Thank you. Bye bye.